Right now, millions of people are walking around with a heart that is quietly struggling to do its job, and many of them have no idea. Heart failure does not usually begin with a dramatic collapse or sudden emergency. Instead, it often begins with small signals that feel easy to ignore. A little fatigue, a little swelling, a little shortness of breath. But these early whispers from the body can be the first warning signs that the heart is slowly losing its strength. Many serious diseases do not appear overnight. They develop slowly, sometimes over many years, long before a diagnosis is ever made. Heart failure is one of those conditions. Before doctors detect it with tests, the body often sends subtle messages that something inside the cardiovascular system is starting to change. In this video, we will explore 7 early warning signs of heart failure that doctors say should never be ignored. Some of these signals may appear in places people rarely connect with the heart. Understanding these signs could help someone recognize a problem early and seek medical care before the condition becomes life-threatening. Number 1. Unusual shortness of breath. One of the earliest signs of heart failure often appears during something very ordinary. Walking up a flight of stairs, carrying groceries, even lying down to sleep. Many people begin to notice that breathing feels more difficult than it used to. They may feel winded after activities that once felt effortless, or they may need to prop themselves up with pillows at night because breathing becomes uncomfortable while lying flat. To understand why this happens, we have to think about the job of the heart. The heart works like a pump that pushes oxygen-rich blood through the body. When that pump becomes weaker, blood can begin to back up in the lungs. This causes fluid to slowly accumulate in the lung tissue, making it harder for oxygen to move into the bloodstream. The result is the uncomfortable sensation of breathlessness. At first, many people assume they are simply out of shape or getting older. But when shortness of breath begins to appear without a clear explanation, especially during normal daily activities, it can be an early signal that the heart is struggling. And ignoring this signal allows the underlying problem to continue progressing. Number 2, persistent fatigue and weakness. Another early sign can feel surprisingly vague. Many people with early heart failure begin to notice a persistent sense of fatigue that does not improve with rest. Activities that once felt easy, walking, climbing stairs, doing household chores, may suddenly feel exhausting. This happens because when the heart cannot pump efficiently, muscles and organs receive less oxygen-rich blood. Without adequate oxygen, the body's cells struggle to produce energy. The brain often interprets this lack of energy as tiredness or weakness. Unfortunately, fatigue is one of the most commonly ignored warning signs in medicine. People often blame it on stress, lack of sleep, or a busy schedule. But when unusual fatigue continues for weeks and begins interfering with everyday activities, it deserves careful attention. Because sometimes the real cause is not stress at all, but a heart that is slowly losing its strength. Number 3, swelling in the feet, ankles, or legs. The next sign may appear somewhere many people rarely associate with the heart. The feet. As heart function begins to decline, blood circulation becomes less efficient. This causes fluid to accumulate in the lower parts of the body due to gravity. People may notice swelling around the ankles, tightness in their shoes, or visible puffiness in the legs. Doctors call this condition peripheral edema. At first, the swelling may appear mild and only occur at the end of the day. But as fluid continues to build up in the tissues, it can become more noticeable and persistent. This happens because weakened heart pumping allows blood to back up in the veins. The increased pressure pushes fluid out of the bloodstream and into surrounding tissues. If ignored, this fluid buildup can gradually worsen and place additional strain on the heart and circulatory system. Number 4, rapid or irregular heartbeat. Sometimes the heart tries to compensate for weakness by working harder. When the pumping ability declines, the body activates stress hormones that attempt to maintain blood circulation. One of the ways this happens is by increasing heart rate. People may suddenly become aware of their heartbeat. They might feel their heart racing, fluttering, or pounding in the chest even while resting. This sensation is known as palpitations. While occasional palpitations can occur in healthy individuals, frequent or persistent episodes can indicate that the heart is under unusual strain. Over time, Abnormal rhythms can further weaken the heart muscle and increase the risk of serious complications. And that is why any new or unexplained change in heart rhythm should always be discussed with a healthcare professional. But here is something many people find surprising. One of the most overlooked warning signs of heart failure does not appear in the chest, the lungs, or even the legs. It appears in something people usually blame on diet or stress: the stomach. In fact, early heart failure can sometimes affect the digestive system before people ever realize the heart is involved. Fluid buildup in the abdomen and reduced blood circulation can influence appetite, digestion, and even body weight. Which brings us to the next warning sign. Number 5, sudden or unexplained weight gain. Weight gain is usually associated with eating habits or physical activity. But in people with early heart failure, weight gain can sometimes occur for an entirely different reason: fluid retention. When the heart becomes less efficient at circulating blood, the kidneys receive weaker signals about how much fluid should be removed from the body. As a result, the body may begin holding on to excess salt and water. This extra fluid gradually accumulates in tissues and organs. People may notice that their weight increases by several pounds over just a few days, even though their eating habits have not changed. Doctors often consider rapid weight gain of 2 to 3 pounds in a short period to be an important warning sign, because it may indicate fluid buildup related to heart function. Number 6, persistent cough or wheezing. Another early signal can appear in the respiratory system. Some individuals develop a cough that does not seem to go away. The cough may produce white or pink-tinged mucus and often becomes worse when lying down. This happens because fluid accumulating in the lungs can irritate the airways. As pressure builds in the pulmonary circulation, small amounts of fluid may leak into lung tissue. This creates congestion that resembles respiratory illness. Many people mistake this symptom for allergies, asthma, or a lingering cold. But when a cough continues without a clear explanation, especially alongside shortness of breath or fatigue, doctors often consider the possibility that the heart may be involved. Number 7, difficulty concentrating or confusion. The final warning sign may be the most unexpected of all: changes in thinking. When the heart cannot pump efficiently, blood flow to the brain may decrease. The brain is extremely sensitive to oxygen levels, and even small changes in circulation can affect mental clarity. Some people begin experiencing difficulty concentrating, forgetfulness, or unusual confusion. Family members may notice subtle changes in alertness or attention. While many conditions can affect cognitive function, reduced circulation caused by heart failure can sometimes be one of them. And because these changes often develop gradually, they are easy to dismiss as normal aging. But when mental clarity begins to decline alongside physical symptoms, it may be an important signal that the body's circulation is under stress. Final, important warning: heart failure rarely appears suddenly without warning. In many cases, the body sends signals months or even years before the condition becomes severe. Shortness of breath, persistent fatigue, swelling in the legs, irregular heartbeat, unexpected weight gain, chronic coughing, and even changes in concentration. Each of these symptoms may seem small on its own, but when several appear together, they may be the body's way of asking for help. Recognizing these signals early can allow doctors to diagnose the condition sooner, begin treatment earlier, and significantly improve long-term outcomes. The human body is remarkably intelligent. Long before medical tests reveal a disease, the body often communicates subtle messages that something inside is changing. Heart failure is not simply a sudden event. It is often a gradual process that begins quietly. By paying attention to the early signals the body sends, people can seek medical advice earlier and take steps to protect the health of their heart. And sometimes, that awareness can make all the difference. If you find clear, science-based explanations like this helpful and want to learn more about how the body signals important health changes, consider subscribing to the channel. New videos explore the fascinating ways the human body protects itself and how understanding these signals can help us live longer, healthier lives.